So now let us look at right atrium and its internal features. So to see that, we'll take an incision this way. Upon opening this incision, we find three walls of the atria. The rough anterior wall made up of musculi pectinate, smooth posterior wall, which is sinus venorum, and then we have the septal wall. So the lightened part is fossa ovalis, which is opening in the embryonic stage. Later, it gets closed in the adult life, and the surrounding is the fossa limbis fossa, which is not lightened here. Now we have this coronary sinus, which is the opening for the vein which drains the blood from heart. Then this is the opening for inferior vena cava and the opening for superior vena cava. The valve in the superior vena cava is Thebesian valve and the valve in the inferior vena cava. Now let us look at the conducting system of heart. The first tissue is the sinoatrial node, which is present at the junction of the crista terminalis and the opening of superior vena cava. The impulses from sinoatrial node are transferred to atrioventricular node and then to bundle of His, which divides into right and left. Then that gives branches as Purkinje fiber. Now let us look at the ventricles. This is the right ventricle, and to look at its interior features, we need to take an incision this way. Upon opening this, we find the walls of ventricles. This is the rough or trabeculated part, and this is the inflow of the ventricle, whereas the outflow is infundibulum, and that is smooth. The inflow is the trabeculated part is trabecular cornea, and the smooth part is infundibulum. On the trabeculated part, you can find the ridges, the bridge, and the pillar. The right ventricle is tricuspid, that means it has three cusps. This is the papillary muscle, this is chordae tendineae, and these are the cusps. This is the anterior cusp, these are the anterior cusps. This is the posterior cusp, and this is the septal cusp. We have a moderator band here, which attaches the anterior wall of the ventricle to the posterior. This is the moderator band.